Imagine you are traveling in Europe and you suddenly need urgent medical care. For an illness you are being treated for, electronic prescriptions, your medical imaging or lab results. In such a case, your own immediate access to your medical records could be crucial in enabling you to receive appropriate medical care.
This is one of the aims of the European Health Data Space, a framework of binding requirements, digital standards and practices for the exchange of primary health data. On March 15, member states meeting in the Council and the members of the European Parliament reached a preliminary agreement on the creation of this EHDS. Negotiators were able to resolve contentious issues such as geolocation, confidentiality and individuals' right to data protection. With the EHDS, European citizens will have easier access to and control over their personal electronic health data. This new autonomy respects patients' right to privacy and enables them to actively participate in deciding how to manage their healthcare. Healthcare professionals will also be able to access patient data, but on a restricted basis, which means when it's needed for a specific treatment. The European Health Data Space is also a game changer for researchers and policymakers. By breaking down barriers to digital data exchange, it provides access to health information for scientific research and public health policy development. It is a boon for research, giving academics and industry vast health data to study. This means faster medical progress and better informed public health decisions.
Crucially, the agreement also protects sensitive health data such as genetic information and imposes strict controls on how the data can be used, preventing misuse for things like advertising or insurance rating.
Once the final text is adopted, a number of tools will need to be put in place, such as a cross-border digital infrastructure to connect member states and share health data, in line with mandatory requirements for interoperability, security and privacy, called MyHealth@EU. Member states will have to set up a digital health authorities to ensure that additional rights for individuals are properly implemented. For the secondary use of health data, mainly for research purposes, another infrastructure, Health Data@EU, will be set up across the EU to connect health data access points. But some say it will take many years and much money to build the structures needed to make this happen. Currently, the level of digitization of health data in the EU varies between member states, making data sharing difficult.
The provisional agreement must get the green light in the Council and Parliament. If approved, it could mark the start of a new era for the healthcare sector.